next speaker, Dr. Ravindran. He is an interventional radiologist at Fraser Health in BC. He's been a mediator and a trainer for over 20 years. He has conducted various seminars and workshops on heartfulness, meditation, and application of various heartfulness techniques to corporations and public organizations. And today he will be speaking to us on cultivating healthy habits to combat chronic diseases. And the presentation would outline the importance of creating healthy habits and practical strategies to cope with chronic diseases with the help of yoga and meditation. And floor is yours.
Thank you, Reza. Thanks to CNS, Jesse, Michelle, and Dr. Garg for having me on board to talk about this. It's been wonderful so far listening to so many of the speakers, seeing something really cool with the last presentation, and something very heartfelt and heart-stirring from from John's talk, and also hearing about so many different things that's happening in the community. And again, I'm really grateful for hearing all of this and inviting us and for allowing us to be part of this journey. So I would like to talk about today specifically on cultivating healthy habits. So this presentation would cover why the need for creating these habits, how we can do that with the help of some traditional practices. Specifically, I'll be talking about 3 techniques. Generally, I take people through my sessions are experiential so that it's just not the theoretical aspect of it, but due to want of time, I'm not going to go into the practice aspect, but just give you a brief overview. But before I start, I would like you to just do this very simple thing. Let's start off with a left nostril breathing. I'm not going to take a long time because I don't have much time, but just close your right nostril and breathe through the left nostril at your own pace. Take it easy. Just breathe in gently and gentle pass and breathe out. The breathing out part is a little longer. The expiration is longer than the inspiration. Let's do it a few times. Take it easy, relax, breathe in and breathe out at your own pace. Breathe in and out. Nice deep breathing. Gentle pass. Long expiration. Okay, one last time. Thank you. It helps to relax and for me to calm my nerves as well. Okay, so just need to figure out how to, sorry, give me 1 second. Okay, there we go. So many have talked about this. The magnitude of the problem is huge. In fact, chronic diseases are one of the most vulnerable groups and also quite prevalent in the community. In the US, according to CDC, 6 in 10 people have chronic disease, and at least 4 in 10 have 2 or more of these chronic ailments. It is a big source of spending in the health, if you look at it, and also the leading cause of death and disability. Situation is not is similar in Canada as well, where at least 4 in 10 people have 1 in 10 common chronic conditions. And if not anything, with the global pandemic, it's highlighted this most vulnerable community and loss of access to many people, loss of lives, and more burden being put on the healthcare system on the whole, where the resources are being shifted to the pandemic. Yet this remains one of the important areas where we need to focus on. With regards to prevention, the Global Burden of Disease study in Lancet put out a study, and they found that most of the risk factors for common chronic diseases are preventable and treatable, and tackling them will of course bring huge social and economic benefits. And CDC put out certain suggestions for prevention, and they are diet, physical activity, smoking cessation and alcohol reduction, getting screened, getting enough sleep, and making healthy choices at work, school, and community. Essentially, this is all about building healthy habits, which really is helpful not just for prevention, but also in people who are suffering from chronic diseases who need to have this in place in order to reduce their complications or having to go into a different illness, having to deal with another illness itself. So when we come to habit, this is the dictionary, Cambridge Dictionary's definition. It's something that we do often and regularly, sometimes without knowing that we are doing it. Essentially because it's programmed into our subconscious mind, because we choose to put that in the first place. And as you all know, the subconscious mind is way more powerful than the conscious mind. Some would say it's, most of the time we run the programs about 80% of the time with subconscious mind. Whatever it is, it's important to know the subconscious mind is reflexive, it's governed by emotions, and it's way more powerful. If there is a tug of war between conscious reasoning and critical thinking and the subconscious mind, our beliefs and emotions will always win. And so, coming to habit changing, when we want to create some healthy habits, it's all about change. And we all know how resolutions work. And when we want to create a new habit, how that would go, how the subconscious mind will take that into consideration. So some of the challenges we face with whether it's with the habit formation, one of the primary things would be emotion. This is not an exhaustive list, but some of the challenges are lack of motivation. It's important to bear in mind that people who suffer from chronic diseases have also a level of anxiety and depression, and most often they may be coexisting. So, and a lot of stress as well. And there could be social or cultural challenges. And it's not just these are some of the challenges, which would prevent us from creating or forming new habits. To overcome these, we need to have a combination of awareness, acceptance, attention, action, also supplemented by motivation and willpower, which all comes from within. Of course, it's great to have a support system in the family or society, which goes a long way. So, some of the toolkits, I'm going to talk about three techniques. First one is meditation. As a technique, this has been studied vigorously, and if you do a literature search, there's probably going to be around 1 million articles on this. This has several proven benefits. Now, for instance, meditation brings about structural changes in several areas of the brain. Earlier on, one of the presenters talked about it, specifically in areas that participate in awareness, attention, and emotional regulation. This is really simple and easy to adapt. The practice I am with, Heartfulness Meditation, it's free of charge. It's easy to adapt, and it's for everyone to take up. The organization has been there for 75 years with existence in more than 160 countries. And we have trainer volunteers across the globe, around 20,000 volunteers who are trainers, and more than 4 million practitioners. We adapt a heart-based technique where we bring the focus in the heart region or the chakra. And traditionally, there are 7 chakras or 7 focus points. We focus on the heart region, and the work here then encompasses all the other chakras and all the other region. And even working on the heart area, it focuses on 5 different subpoints, where I would like to call as 5 C's. As we meditate on the heart, we go through this aspects of 5C, meaning namely contentment, compassion, calmness, courage, and clarity. And as we transform and as we progress, we then go into different regions, different beyond the 7 chakras as well. The unique aspect of the heartfulness practice is this aspect of what we call as pranahuti, or transmission. It's just a pure vibration from the source that helps in progress and our transformation. It helps us to achieve deeper states of absorption effortlessly, even in novices, meaning somebody who's not had a prior experience of meditation. That's one technique which we all are aware of. The other technique in the toolkit I would like to talk about is the cleaning, the heartfulness cleaning. Not many of you, or maybe all of you, may not have heard about this particular process. It's a unique technique of heartfulness where the impressions that are laid down over a period of time, they are being cleared away. The emotional memory and the network these impressions create, they get implanted in the subconscious mind. That's what creates the habits, and that's what leads to further thoughts, actions, and habits. And in order to address that, we need to clear these impressions. And that's where the clearing away of the subconscious mind helps and goes hand in hand with meditation. So what we are essentially doing is to build new neural connections, or forming new habits, what we call as neuroplasticity. And the good thing to know about neuroplasticity is not restricted by age. Examples of people taking up music, or picking up a new language at any age. Essentially, we are trying to create these new pathways by trying to do that. And cleaning is a process which helps in clearing away these previous pathways. When we want to create a new habit, we have to break down a old habit and create a new pathway and sustain it. Cleaning helps in both by removing the impressions lying deep within us, and the sustenance part comes by, as we do the process, our willpower gets enhanced gradually as well. And the cleaning has several offshoots, which helps in several different scenarios, and this can be done personally or with the help of a trainer. Essentially, these are simple, practical technique, and that helps in bringing about change within us effortlessly. And like I said before, it supplements the meditation. I often tell people meditation alone is not enough. Sometimes even as meditators, we may be constantly thinking about one thing or brood over one thing. And this is where the process of cleaning is extremely helpful. Last part is the left nostril breathing. I'd like to say this is an extremely simple technique where I've often suggested this to a lot of my colleagues and patients, and even carers, and the people who I teach meditation to as part of workshop. The left nostril breathing, which we did, is intrinsically related to the parasympathetic pathway. Right nostril breathing activates the sympathetic pathway. Left nostril breathing activates the parasympathetic pathway. And these two streams, we are in a flux of these two streams all the while. And this simple technique helps to calm the mind, helps to calm the body as well. And it's such a simple practice, you can put it into place anytime. If I'm at work and I feel I'm rushed, I just do this for some time, about 10 times. It helps me to calm down. And also, if somebody's having difficulty falling asleep, they can try and do this just before sleeping or before a meeting, just like this, before a presentation. It gets everybody to calm down and be in a gentle frame of mind. So in essence, or to summarize, I say yoga, meditation, pranayama, and asanas. Asanas is the popular form of yoga as we talk about, but this is all under the umbrella of Ashtanga yoga or yoga. It plays a big role, not just in maintaining health, but reducing the burden of chronic illness. I would say it's quite helpful, not just for people who are suffering from the chronic illness, but also for the carers and the immediate family members, and us doctors and other carers as well, where we need more compassion and more protection for ourselves so that we don't burn out. The advantages of these techniques are these are really simple techniques, easy to incorporate, does not require any investment at all, brings enormous health benefits. Not just that, it plays a huge role in transforming individuals. So that's what I would like to leave you at. And if you would like to find more about this practice and would like to explore further, you can you can go to heartfulness.org/ca, and there are master classes and various other tips to enhance one's inward journey. and you can find out more, experience more about it. And if you would like us to do a workshop, we'll be happy to set something in place as well. And thank you again for the opportunity.
Thank you very much. And that potential option of a workshop, that sounds very interesting to me. I think I would love to learn more about it. And thank you for clarifying the difference in the left nostril and breathing in the right nostril. I was wondering why it was just the left side. So